So in this video we're going to be talking about slip disc symptoms and what you can do about it. My name is Dr. Brad Wolf, and I'm here to help you to avoid spinal surgery and to live the best life possible. So when we're looking at the disc in the spine, it's really like a circle. And we draw a big circle here. The center of the disc is about the consistency of toothpaste. The outside of the disc is made out of cartilage. And so we're going to draw these The outside of the disc helps to keep that center of the disc in the right place. So if you've ever done anything where you're hanging something on the wall and you have a little bubble in the middle and you want that bubble to be in the middle, well, that's kind of what you want to do with the disc. You want to keep the center of that disc in a balanced place. And so we've talked in other videos about how we want the positioning of the spine to be in a nice stable place. But what happens is you have a process of degeneration that happens in the spine. And we all start here, and if we're not careful, we start wandering down this road here. Now, I see people in my office that are all the way down here. That looks disgusting, doesn't it? Well, we want to keep the spine down in this area here. So when we keep the body in a better positioning, it's going to help you to heal your slip disc. And slip disc is really a misnomer. The disc doesn't really slip. What happens is it tears and then it ends up moving. And so when we're looking at this disc, we have a nerve that runs by here. And as the center of this disc here starts to swell, it's going to put pressure against that nerve. So when you get what they call a slip disc and there's pressure against that nerve, we want to retract that disc away from the nerve. Oftentimes when they do surgery, they literally just lop it off. The problem with that is if this much is sticking out here and we cut off the end, then this end is wide and this end is narrow, and you're going to risk injury and causing problems down the road. And so when we're looking at the disc and healing the disc, positioning is number one. The second thing, which we've talked a lot about, is about managing the inflammation. And so the easiest, most direct way to do that is actually to use ice or a cold pack. Now, a lot of you have used heat in the past. We don't want to use heat. When you have a disc problem, you have inflammation. Inflammation in the body is indicated. You're going to feel, potentially if you put your hands on your lower back, you're going to feel heat coming off your lower back. We don't want to put heat on top of heat. Use cold, and that cold will help to draw some of that heat out of the body. The third thing that we're going to do is we're going to strengthen the back. Okay, so once you have the positioning right, we have this disc here, and the disc is staying in the center. And we want to keep it in the center. Okay, and we want to reinforce that. So if your disc is already injured, sometimes we have to do some work to get the body in a balanced place. But these three principles, positioning, manage the inflammation, and strengthen your body, stabilize. And so when you're stabilizing your body, we're going to look again at working on your core and working on your legs. We strengthen the back, we strengthen the abdominals, we strengthen the glutes, the quads, the hamstrings. All of that need to be strengthened. And when you're looking at the core, it's really from here all the way down to just above your knees. And in strengthening your body, you're going to help to keep your body in a more stable position and help to heal that slip disc in your lower back. The next video is going to be called, What is Scoliosis and What Can I Do About It? Thanks for watching.